Hi, good morning, I'm Isaac Clark. I'm the invigilator for the OET test conducting on 26/05/2020. May I know your name, please?
Hi, good morning. My full name is Justin Christopher.
Can I have your passport, please?
Yes, of course.
Can I have your candidate number, please?
My candidate number is 246793.
Alright, we can now begin the warm-up session. How do you practice self-care?
Most of us live a busy life, have stressful jobs, or we are too consumed with technology to make time for ourselves. The result is that we become stressed and burned out. In order to nurture the health of our mind, body and soul, it is important that we give time to ourselves. Self-care helps us to stay healthy and be resilient. But it is not very easy to practice self-care. It will not happen unless you intentionally do it.
Would you handle a disease outbreak?
The main purpose of outbreak management is to protect public health by identifying the source and implementing control measures to prevent further spread or recurrence of the infection. So, we have to gather information about the characteristics of suspected outbreak, persons directly affected by the outbreak, population at risk of exposure, and the geographical area and environment involved. We have to then interpret, prioritize, and act on them. We should also make sure that the local health protection team is informed about the outbreaks in a timely manner, so the necessary steps can be taken for its containment.
If you saw someone administering improper medicine, not washing their hands, what would you do?
It is a case of unethical behavior, because of the potential for interference with patient care and safety. I'll speak up when an unethical situation occurs that could jeopardize patient safety. We should also make sure to speak up in a positive manner, so that we could encourage the person to listen, change their behavior, and be more thoughtful in future.
Describe a time you provided effective patient or family education.
Once I had a patient who was unable to reduce his blood pressure following heart attack. I educated him about diet and exercise, and how he should change his routine, so that he could control his blood pressure. 3 months later, he sent me a letter saying how his blood pressure and lipid profile were all down into a normal range.
Give an example of a mistake you've made. How did you handle it?
I was on duty in general medicine unit. There was this patient whom I have to administer a newly prescribed antibiotic. I gave him the test dose, but forgot to give him the full dose. It was a busy day, and my shift was near to end. Also, I had an appointment, so I left in a hurry. But I remembered it after on my way home. I passed on the information immediately to the nurse on duty. Luckily, it was not so late, and the medicine was given. I learned from my mistake. Now I always make sure not to miss any medication and to chart it correctly.
That's the end of the warm-up session. Now, we can move on to cue card sessions. I'll help you with the task questions. This is your task card. You have 3 minutes to prepare with the task card. Your time starts now.
Okay. Thank you.
Alright, your time is up. You can now start the roleplay.
Hello, my name is Peter. I am a registered nurse from the hospital where you underwent your knee replacement surgery. Today, I am here to check the progress on your recovery. What do you prefer to be called?
Hello dear, you may call me Mr. Anderson.
Alright, Mr. Anderson, how are you today?
I'm doing well.
Oh. I am glad to hear that. Do you face any troubles like pain or swelling in the knee?
No, I am completely alright, and I hope that I am recovering well.
That's good. Before proceeding further, I have noticed that you are not using your walker while walking. At the time of discharge, you were advised to use a walker at home till your next follow-up appointment. May I know the reason for not using the walker, please?
Oh nurse, I found that I am able to walk even without using a walker. So, I left using it last evening. I hope that it is a positive sign of recovery.
Of course it's a positive sign, but being a patient under treatment, you are supposed to follow the orders of the doctor. Therefore, you cannot withhold using a walker while doing the daily activities.
Yes, I know, but I had used it for 3 weeks. Unfortunately, I did not find any use of it. Moreover, I can easily walk without any pain.
I can understand your concern, but it is mandatory to follow the post-discharge instructions because those are given for your fastest recovery. If you are not following it, that may lead to some adverse effects on your knee. Don't you wish to gain a faster recovery?
Yes, I wish to get better, and you know I am doing everything for that. I am doing regular exercises and take all my medicines on time. I feel pretty good after practicing these. So, I really feel that I don't want a walker to support me when I walk.
Yes, I appreciate you for that, but during the post-surgical period your knee muscles will be very weak for the time being. Your leg and muscle need some time to regain its strength and endurance. That is the reason why we provide you with a walker. This walker will help you to put less weight on the operated knees. Moreover, it is a preventative and protective measure. A walker will help with your balance and prevent falls.
Yes, I understand what you are saying. But, I am not a person who wishes to be dependent. Whenever I use the walker, the first feel like it's taking away my freedom for being independent.
All right, Mr. Anderson. I understand your perspective. But, let me explain why it is important to use a walker until your complete recovery. Shall I proceed?
Yes, you may please.
Mr. Anderson, you are not going to use the walker for a long time. The doctor will ask you to stop using the walker as soon as he feels that your knees have recovered completely. Furthermore, using the walker is simply a smart decision to prevent further complications. So, don't think that it will make you dependent.
I have been a very active man all my life. For me, using a walker is a sign of disability.
Yes, I realize this is difficult for you. Walker is not going to control your freedom of movement. It helps you to facilitate the movements by giving not much strain to the operated knee.
Since it's been 3 weeks now, I thought I had overcome the need of using a walker.
Yes, I know that, but it is to eliminate the risk of causing injuries. Moreover, without a walker there is a probability an extension of your healing period. Do you really want it to happen?
Of course not.
During initial weeks after knee replacement surgery, many people have tried and are prone to falls. Therefore, the use of walkers are very necessary to prevent serious fall injuries. Now, I hope you understand the use of walkers in faster recovery.
Yes, it sounds practical.
Yes, it is only required until your next visit to the doctor. As your knee strengthens, you will be able to walk on your own soon.
Alright, I suppose I can use it for a few more weeks.
That's great. Do you have any further clarifications?
Oh, no dear. Thanks for coming today and giving all this valuable information.
You're welcome. Get well soon.
Thank you. This is the end of your speaking test. Thank you.
Thank you, sir.
Thank you for watching. Please, like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.